True vocal folds are lined by stratified squamous epithelium. Regarding respiratory system, lamina propria contains exocrine gland. Goblet cells secrete serous secretion. Ceromucous glands secrete serous secretion. Bronchioles don't have cartilage. Goblet cells are absent in terminal bronchioles. They are replaced by Clara cells. Regarding surface anatomy, inferior border of costal margin goes down to L3 vertebral level. Cervical pleura extend from junction of the middle and medial 1/3 2.5 cm above, from medial 1/3 to 1 to 2 cm, from first rib 3 to 5 cm. Apex beat of heart is on the fifth intercostal space just medial to midclavicular line. Auscultatory area for tricuspid valve is in the lower sternum. Regarding telechest X-ray, film focus distance is 180 cm. Regarding the telechest X-ray taken with breath held in respiration, X-ray beams is centered T6 T7 vertebral level. Pleura in the cervical region extend up to lower border of the neck of the first rib. Never crosses the neck of first rib. Pleura crosses 8th rib in the midclavicular line and the 10th rib in the mid-axillary line. The visceral pleura adheres close to the pulmonary surface and fissures. Visceral pleura drains via bronchial veins to esophagus system. Pleura consists of flattened cuboidal mesothelial cells. Regarding thoracic vertebral column, flexion and extension occur, mainly rotation. Maximum rotation. Regarding thoracic vertebra, maximum rotation. Disc contribute 1/5 of its length, 20 to 25%. Ligamentum flavum connect lamina of adjacent vertebra. The typical rib has angle. The subcostal groove in the inferior border. After the head and neck of a rib, it is tubercle. The typical rib has articulated two vertebra, R, L, low, V, up. Rib of the same number with the lower facet. Vertebra of the same number with the upper facet. Angle, which is the most likely part to fracture in trauma. The angle is the weakest part. Structure that appears in the intercostal drainage in fifth intercostal space, serratus anterior, parietal pleura, internal intercostal muscles. When right main bronchus is dissected, the structures that are encountered are right phrenic nerve, right vagus nerve, esophagus vein. Regarding thoracic vertebra, 2 to 10 vertebra are typical thoracic vertebra. Costal facet of T11 vertebra is complete. Spines are longest in T5 to T9 spinous processes. The obliquity increases from T1 to T7 and then decreases. So the middle one, T5 to T9, will have the longest. Vertebra is articulated with each one other by secondary cartilaginous joint. IVD midline structure have secondary cartilaginous joint. Vertebral disc. Regarding thoracic vertebra, primary ossification centers 3, secondary ossification centers 5. Correct. Regarding intercostal muscle, intercostal nerves arise from the anterior primary rami of thoracic spinal nerves. In the greater part of the intercostal base, the nerve lies between intercostalis intimae and internal intercostal muscle. Intercostalis intimae is innermost intercostal muscle. Bronchopulmonary segment, there are 10 segments on each side. Some sources say that the left lung has only 8 segments, but the last says that there are 10 on both sides. Bronchopulmonary segment, independent functional surgical unit. Each has its own arterial supply. Regarding bronchopulmonary segment, each segment has more than one vein. Veins are in the intersegmental septa. Bronchopulmonary segment can't be referred to as vascular segment because they are supplied by more than one pulmonary vein. Regarding pleura of lungs, parietal pleura is thicker than visceral pleura. Regarding pleura of lungs, cervical pleura extend up to the neck. Regarding pleura of lung, pulmonary pleura has autonomic innervation. Regarding pleura of lung, only the visceral pleura is the same. Internal thoracic artery supplies the breasts, supply the pericardium. Internal thoracic artery arises from first part of subclavian artery. Internal thoracic artery supply the thymus. T8 vertebra makes synovial joint with secondary cartilaginous joints, head of 8 rib. Superior articular process of T9, inferior articular process. Regarding trachea, Angle of current lowest up to the T6 level in deep inspiration. Regarding trachea, it lies posterior and to the right of the arch of Vada. Cartilage are regarding trachea, cartilage are deficient posteriorly. The root of the lung, right pulmonary artery lies anterior to the root of the right lung. Right penic nerve runs anterior to the right lung root. Esophagus vein arched at the top of the lung root. Cuff of the pleura envelopes the vessels and nerves, forming guarding root of the lung. Roof floor line. Right vagus lie posterior to the root of the lung. Greater splanchnic nerve are preganglionic fibers pass into the abdomen. They arise from sympathetic trunk. Great splanchnic nerve supply involuntary muscles. Cells found in bronchioles, goblet cells. Type 2 pneumocytes තියෙන invalvuli. Classic cells, enterochromaffin cells වල තියෙන්නේ. Chondrocytes the no cartilage. The respiratory bronchioles, ciliated cuboidal epithelial cells, non-ciliated clara cells. The respiratory bronchioles, there are few goblet cells. Bronchioles have no cartilage. Respiratory bronchioles participated in gas exchange. In respiratory bronchioles, surfactant found in alveoli. Cervical rib ගත්තාම 0.5 of general population තියෙනවා මේක seen වෙනවා. Cervical rib connects the transverse process of 7th cervical vertebra to the first rib. A cervical rib may be represented by a fibrous ligament in distal part. Cervical rib may elevate the artery. A cervical rib can cause pressure on the lowest trunk of the brachial plexus. The right vagus nerve runs on the surface of the trachea. Right vagus nerve passes medial to the arch of the esophagus vein. Right vagus nerve passes posterior to the right bronchus. Right vagus nerve supplies the branches to the pulmonary plexus. Right vagus nerve gives recurrent branch near the arch of Vada. Not for right vagus but for left. Which of the following structural vertebral levels are correctly matched? Sternal angle T45, mnemonic for structure T45 level is rat plan. Bifurcation of trachea T45, esophagus vein SVC D45, diaphragmatic opening at T8, aortic opening T12. Regarding lymph nodes of the thorax, parasternal nodes lie along the internal thoracic vessels. Parasternal nodes receive lymph from mammary gland. Lung drain to bronchopulmonary or hilar node. Efferent from tracheobronchial nodes and parasternal node. Bronchomediastinal lymph nodes trunks receives efferent from tracheobronchial nodes and parasternal nodes. Intercostal lymph nodes drain to the thoracic duct. Intercostal nerves are formed by the ventral rami of the thoracic spinal nerve. Intercostal nerve. Armpit has T2 supply. Intercostal nerve lie directly on the parietal pleura where the innermost intercostal muscle is missing. Intercostal nerve pass anterior to internal thoracic vessel. Regarding contravertebral joint of 2 to 9 ribs, head of the rib makes a sinusoid with its vertebral body. Head of the rib articulates with the vertebra above. The head of the rib articulates with intervertebral disc between its own vertebra and the vertebra above. The tubercle of the rib articulates with the transverse process of its own vertebra. Medial plate, smooth part is tubercle. The axis around which the rib moves passes through the head and the tubercle. During inspiration, in quiet respiration, the first rib remains relatively fixed. 2 to 7 ribs mainly increase the anterior posterior diameter, lower rib increase transverse diameter. Vertical length increased by the contraction of diaphragm. Manubrium sterni moves up with the first rib as one piece. In deep inspiration, the first 2 ribs together with the manubrium move up as one piece. The body of the sternum moves anteriorly with the 2 ribs. Pump handle movement. The false rib resists the tendency of the diaphragm to draw the costal margin inward. False rib are 8 to 10. The 11th and 12th rib prevent the diaphragm from tracing the costal diaphragmatic recess. Because the held down by post-abdominal wall muscles such as quadratus lumborum. In the diaphragm, the esophageal opening lies between the right crest of the diaphragm. Esophageal hiatus traverses both left and right vagus nerve as anterior and posterior trunks. Inferior vena cava lies between the middle and right leaves of the central tendon. The opening of the inferior vena cava transmits the right phrenic nerve. Subcostal nerve passes posterior to the lateral arcuate ligament. Regarding thoracic sympathetic nerve, the sympathetic trunk has both gray and white primary communication. Right splenic nerve carries mainly preganglionic fibers. Fibers from second and fourth ganglion supply the deep cardiac plexus. Thoracic sympathetic trunk is responsible to dilate the pupil since the sympathetic trunk fibers arise from the thoracolumbar part of the spinal cord. First thoracic ganglion is frequently fused with the inferior cervical ganglion to form stellate ganglion. Regarding pleura, medial sternal pleura is supplied by the phrenic nerve. Tracheobronchial nodes are found at the tracheobifurcation. Visceral pleura along with the lymph drainage of the lung may drain to this node. Medial sternal pleura is a component of parietal pleura. Parietal layer crosses at the 10-3 below, not the below. Costal pleura is pain sensitive, parietal pleura is pain sensitive. Regarding about lung, apex of the lung is related to medial 1/3 of clavicle. Oblique fissure correspond to medial border of the scapula. Both lungs have impression for the esophagus on medial aspect. Lung roots lie opposite the border of the T5 to T7. Each segment has more than one vein and each vein drains more than one segment. Regarding lower respiratory system, trachea is mobile and full inspiration descends up to T6 level. Trachea is deeply placed in children. At the end, its child runs right side of the midline. Right mid bronchus is more vertical than left. Inhaled foreign bodies are more likely to enter the right lung. The right mid bronchus gives off the upper lobe bronchus outside the hilum. Regarding larynx, posterior cricothyroid is only abductor. Larynx has only one abductor. Below vocal membrane is innervated by left recurrent laryngeal nerve. Above it is innervated by the internal branch of superior laryngeal nerve. Ventricle lies between two folds. Lymph above vestibular fold goes with superior laryngeal artery. Glottis lined by stratified squamous. Two are folds with smooth medial facet of the tubercle of rib articulate with transverse process of vertebra. Twisting of the ribs occurs at the angle from the sharp lower border of the rib above. Internal intercostal muscle arise from the costal groove. Costochondral joints are primary cartilaginous joint. Every rib has its costal cartilage at its anterior end. True about the suprapleural membrane. Seventh cervical suprapleural membrane is attached to the transverse process of seventh cervical vertebra. Subclavian vessels lies on the suprapleural membrane. When suprapleural membrane is damaged, will cause pneumothorax. Suprapleural membrane is derived from the scalenus minimus muscle. Regarding the diaphragm, muscle fibers interdigitate with transverse abdominis muscle. Fibers arising from the lower six costal cartilage and the ribs interdigitate with transverse abdominis. Mogagni hernia type of hernia is called as Bogdalek hernia. Mogagni hernia is anteriorly between xiphoid and costal origins. Five fibers of right crest surround the esophagus. Medial arcuate ligament is thickening of the psoas muscle, psoas fascia. Only the left phrenic nerve pierces, the right phrenic doesn't pierce. It runs through the opening of the diaphragm, which is for inferior vena cava. Hemus esophagus passes through left crest. Both vagal trunks accompany the esophagus. Thoracic duct crosses with the aorta at the 12 level. Right, only left phrenic nerve pierces the central tendon to enter the abdominal cavity. Regarding the muscle of the thoracic wall, transverse thoracic muscle fibers run in many directions. Innermost intercostal muscle passes through more than one intercostal space. Posterior intercostal muscle arises at the tubercle of the rib. Serratus posterior superior is the subpalpal anterior rami. Thoracic muscles are innervated by the intercostal nerves. Regarding the superior vena cava, drains the posterior abdominal wall, via the esophagus vein, which is formed by the subcostal vein and ascending lumbar vein. Superior vena cava is formed at the lower border of the first costal cartilage. Superior vena cava is covered by fibrous pericardium. Pierce the pericardium at the level of the second costal cartilage. Superior vena cava is related to the medial surface of the right lung. Trachea is posteromedial to superior vena cava. The thymus is primary lymphoid organ. Thymus is derived from third pharyngeal pouch. Thymus produces hormones which stimulate production of lymphocytes in other lymphoid tissue. Following are the structure make impression on the right lung: esophagus vein, inferior vena cava, esophagus. Regarding bronchopulmonary segment, typical right lung has 10 bronchopulmonary segment on each side. In supine position, the part first to be aspirated is the superior segment of the right lower lobe. Branches of the bronchial artery which run along the bronchial tree. Respirated bronchioles are supplied by bronchial artery. Vagal afferent cause bronchoconstriction, parasympathetic. Regarding the right lung, only the pleura crosses the 12th rib at the lateral border of the erector spinae. The oblique fissure of the right lung extends from the spine of the third thoracic vertebra to the sixth costal cartilage in mid-clavicle line. Horizontal fissure always present on the right side to separate the middle and inferior lobes of the lungs. Right phrenic nerve anterior to the right lung root. Inferior border of the lung crosses the sixth rib in mid-clavicle line. Regarding the intercostal neurovascular bundle, all posterior intercostal nerves rise from the anterior rami of thoracic spinal nerves. Intercostal neurovascular bundle runs in the posterior groove. Intercostal space contains one posterior intercostal artery and its collateral branch and two anterior intercostal arteries. Intercostal nerves run between innermost and intercostal and internal intercostal muscle. All lower posterior intercostal arteries supply the diaphragm. The thoracic duct passes between the right crest of the diaphragm. Thoracic duct crosses behind the esophagus in T4-T5 level. Thoracic duct drain to left internal jugular vein. Thoracic duct drains the left lung. Thoracic duct receives lymph from left side of the head and neck. The sympathetic trunk, most ganglia lie anterior to the heads of the ribs, except stellate ganglion. The sympathetic trunk forms cervicothoracic ganglion or the neck of the first rib. Sympathetic trunk postganglion nerve exit via the gray rami communicants. Sympathetic sensory neurons from the viscera runs without synapsing at sympathetic ganglion. Visceral pain fibers reach the spinal cord. Regarding sympathetic trunk contains the cell bodies of the postganglionic nerve. Which of the following structures are directly associated with right lung? Subclavian artery, arch of esophagus, superior vena cava, esophagus, right vagus nerve. Bronchopulmonary segment, each side has 10 segments. In the supine position, ventral respirator first seep into superior segment of right lower lobe. Branches of bronchial tree artery which run along the bronchial tree. Segment bronchi derive oxygen from bronchial tree. Vagal afferent cause bronchoconstriction. Regarding the parietal pleura of the lung, it crosses the 12th rib at the lateral border of the erector spinae. Regarding parietal pleura of the lung, do not extend above the neck of the first rib. Regarding parietal pleura of the lung, it crosses lower border of the costal margin at T8 level mid-clavicular line. Regarding parietal pleura of the lung, attack to the mediastinal surface of the fibrous pericardium. Parietal pleura of the lung forms the pulmonary segment when joining with the visceral pleura. Regarding the joints of the thoracic wall, sepisternal joints start to ossify in middle age. Costochondral joint is a primary cartilaginous joint. Surface of the costal cartilage 6 and 7 joined together by synovial joint. Primary cartilaginous joint, all the other ribs articulate the synovial joint. The manubriosternal joint is a symphysis, a secondary cartilaginous joint. Thoracic movements and respiration. Intercostal muscles prevent paradoxical movement in the interspace. Paradoxical movements are abnormal thoracic movement. Inspiration, the thoracic muscles moves inward. Thoracic movement are facilitated by hinge movement at the manubrosternal joint, pump handle movement. First move in maximal inspiration. During maximal inspiration, the 12th rib fixed by quadratus lumborum. Rib is held in position by the muscle which has its origin in iliac crest. External intercostal muscles are active in forced inspiration. Expiration is not an active process. Fourth rib on right side, third and fourth thoracic vertebra. Oblique fissure approximate the fifth rib. Transverse fissure approximate fourth costal cartilage. Fourth rib on the right side was survived by the endochondral ossification. Fourth rib on the right side forms a fibrous joint with form for primary cartilages joint with corresponding costal cartilage. 22 to 6 costal cartilage receives the attachment from transverse thoracic muscle. Regarding the intercostal spaces, it contains intercostal nerves in the lower border of the upper rib. Medial to the costochondral joint is not covered by external oblique muscle, replaced by external intercostal membrane. First two intercostal spaces are supplied by superior intercostal artery, branch of costocervical trunk. Intercostal nerve passes between internal intercostal and innermost intercostal muscle layer. Lateral cutaneous branch of the second intercostal nerve supplies the middle side of the intercostal brachial nerve. Structure forms the groove on the right lung mediastinal surface. Trachea, esophagus, right vagus nerve. Regarding bronchopulmonary segment, each side has 10 segments. In supine position, material aspirated first seep into the superior segment of right lobe. Branch of bronchial artery runs in septa between bronchopulmonary segment. Each bronchopulmonary segment has its own tertiary bronchus. Regarding parietal pleura, it crosses the 12th rib. Parietal pleura never extends above the neck of the first rib. Regarding parietal pleura, crosses the lower costal margin at T8 level in the midclavicular line. Parietal pleura surface marking shows the pattern of the 8, 10, 12. Parietal pleura plain from the mediastinal surface is carried via the phrenic nerve. Mediastinal pleura is innervated by the phrenic nerve. Regarding parietal pleura, visceral pleura penetrate the interlobular cleft. Regarding intercostal pace, neuroscalar bundle is found in the lower border of the first rib. External intercostal muscle is replaced by anterior intercostal membrane medial to costochondral joint. Upper two intercostal spaces are supplied by the superior intercostal artery, branch of costocervical trunk, which arises from the second part of the subclavian artery. Right posterior vein drains to esophagus vein, but first intercostal vein drains to right brachiocephalic vein. Neurovascular bundle is between internal intercostal and innermost intercostal muscle layers. Guardian to the histology of respiratory tract, respiratory ventricle non-ciliated, cilia hinder gas exchange therefore absent. Alveolar septum is the wall between adjacent alveoli. Cartilages are seen in segmental bronchi. Segmental bronchi, tertiary bronchi. Up to this level, there are cartilages in the wall, patchy irregular plate cartilage, but bronchial duals are completely composed of smooth muscles. Alveolar folds allows small movement of air between adjacent alveoli. Which of the following cells in respiratory tract are correctly their function? Type 2 pneumocyte reduce surface extension. Flower cells act as stem cells. Goblet cells secrete mucus. Pneumocyte type 1 take part in gas exchange. Duct cell phagocytic. Alveolar macrophages. Internal thoracic artery supply the breast. Supply the pericardium. Pericardiophrenic branch originate from the costocervical trunk. Internal thoracic artery from the thoracic trunk, which is a direct branch from the subclavian artery. Internal thoracic artery supply the thymus and inferior thyroid artery. Regarding trachea, it lies anterior to the esophagus in the superior mediastinum. Left major bronchus is more horizontal than right. In deep inspiration, The carina may descend as low as 6th thoracic vertebra. Carina is the inferior wedge portion of the tracheal bifurcation. Trachea it lies posterior and to right to the arch of the aorta. External intercostal muscle extend from superior costotransverse ligament. Suprapular membrane transverse process of it is attached to the transverse process of C7 vertebra. Right side subclavian vessels go over suprapular membrane. When damaged, suprapular membrane will cause pneumothorax. Suprapular membrane derived from the scalus minimus muscle. Innermost intercostal muscles span over more than one intercostal phase. Posterior intercostal membrane extends from the angle of the rib to the superior costotransverse ligament. Posterior serratus muscle are supplied by the anterior rami. External intercostal muscle extend from superior costotransverse ligament. Regarding imaging of the respiratory system, the patient is advised to hold the breath in deep inspiration to erect the chest X-ray. Regarding diaphragm, entire motor supply from the phrenic nerve C3 to C5, C4 prominent. Guarding diaphragm fibers from right crus. Medial arcuate ligament is a thickening of the psoas fascia. And damage to one phrenic nerve causes radiologically visible elevation of that side of diaphragm. Normally, diaphragm is in tonic contraction. When it is lost, it relaxes and ascends.